So with that this morning, thank you all so much for being here for our forums. We have Miller-Dwan Foundation's HopeX Campaign is the topic today, and we're going to be joined by Traci Marciniak, President of Miller-Dwan Foundation, and Rick Gertsema. Gertsema.
There you go.
Rick Gertsema, Senior Mental Health Advisor for a forum about the HopeX Campaign. This past summer, the Miller-Dwan Foundation announced a new multi-phase initiative to combat unmet mental health service needs in the Duluth area. HopeX, or Hope Multiplied, is an innovative and community-oriented campaign that will include a workforce expansion and create new programs to help fill those gaps of mental health services in the area. The global partners include the World Health Organization, George Washington University, the New School, and Zak Williams, mental health advocate, entrepreneur, and son of late actor Robin Williams. What a great team you've assembled, and give it up for Traci and Rick. We're so glad for having you join us today.
Hi.
The crowd goes wild.
Oh. Great, big applause. Thank you actually for letting us come and chat about this. We're really excited, and I think as we go out in the community and talk about what it is we have going on, the excitement continues to grow because there is significant potential here with what we're doing to truly transform how mental health care is provided. So I'll give you a little bit of history about Miller-Dwan Foundation before we start. We have been around this community since 1973, and we were created with a gift through the Dwan family way back then. And the instructions from the Dwan family at that point in time was that we were not only supposed to support the services of Miller-Dwan Medical Center when it was its own independent hospital, but we were supposed to be doing work in the community as well to benefit the health of people who live in the region. So even, way back when, we were providing grant dollars to organizations outside of the hospital, which was really kind of a unique sort of thing to do when you were part of a hospital. When the merger between Miller-Dwan Medical Center and Essentia Health happened in the 2000s, the Miller-Dwan Foundation actually separated itself out and became an independent nonprofit. And the reason we did that was so that we could continue to really honor the wishes of the Dwan family by giving money throughout the community to improve health. So that sometimes is a little point of confusion for people because we're still very closely tied to Essentia because we do hold a lot of funds for some of the historical Miller-Dwan services, but we also are completely independent. They're just our really good friends and we live in their building. So one of the things that has happened over the years, and I'm sure you all know this personally and through your associations, is philanthropy really started to change even prior to COVID. So we as an organization started looking at how can we develop some strategy so that we have the most impact on the greatest healthcare needs in our community. So we actually went through a whole year-long strategy session with someone that we brought in. And I think it was no big surprise to anyone that mental health was really the healthcare need that rose to the surface. So we developed this whole vision around we're going to eliminate the mental health crisis in our region, which is obviously a big, bold, audacious goal, but you have to be bold in order to make movement, right? So part of what we did was we needed someone on our staff who had some really significant expertise in behavioral health, which we didn't necessarily have. So we actually went out, and that's where Rick Gertsema came into play. So I'll let Rick introduce himself.
I'm Rick Gertsema. I'm a child adolescent psychologist, and I was at Essentia for 25 years, but I've been closely tied to the foundation actually since Amber Wing opened. Amber Wing is a child adolescent partial program. So I was part of the visioning. Go ahead. Sure. Normally I have such a big mouth that I try to stay away from that. Yes. So I was part of the visioning for Amber Wing for about 5 years. So did a lot of work in the community trying to figure out really where the gap was in the child adolescent world. So from there, to now being with the foundation for just over a year. And when I started with the foundation, Traci asked within those first 3 to 6 months if I would do a lot of work, a deep dive into what was happening with mental health crisis. So really look at what's happening globally, because we know that the entire world was affected by COVID-19, by the pandemic. So look at the great big picture, then look at what's happening nationally, and then let's take a look at what's been happening locally. And so the place I started was the World Health Organization. And I truly started emailing people all over the world. And I didn't know that there was such thing as a translate button in email where you just click a little thing and it just goes into English. So I was able to then ultimately contact from the World Health Organization to the Pan American Health Organization to some really wonderful universities in Europe who we're all trying to address the same issue, right? It's all about how do we really deal with this whole mental health crisis. And so this lovely person from Amsterdam said, I think you might want to get in touch with somebody in New York City by the name of Dr. Adam Brown, who is at the New School for Social Research. They're doing a really innovative program, and it's called Recoup New York. And I thought, wow, okay, I'll give that a try. So I emailed Adam. We now consequently, fast forward, are in a collaborative relationship with the New School for Social Research. He then connected us with George Washington University, and GW with the New School is helping the Miller-Dwan Foundation launch a program, the second in the United States, and it's called Problem Management Plus. PM Plus is a way to really address and grow an entirely different workforce than what we currently have. So basically PM Plus it's a 5-session intervention that's delivered by lay people or non-specialized, not needing a degree necessarily, not working in human services necessarily, people meeting people, for instance, within this environment. There could be people trained in PM Plus who could deliver these 5 sessions and get people moving again to deal with low and moderate levels of stress. It's not a crisis intervention. And actually, we just started our training program. Here's our workbook. I'll actually just pass this around. You can see what the 5 sessions look like. And really, it's teaching people, number one, in the first session is talking about mindful breathing. So we all forget to breathe. When we get stressed, we forget. It's shallow breathing. We don't have our feet on the ground. So it's really, how do we manage stress? Doing some breathing. The second session is managing problems. So in the second session, really talking about, let's talk about every problem that you might have in your head right now. Let's just list every single one of them. And then we're going to talk about which ones are under your control and which ones are not under your control. And now, out of all the ones that are under your control, how about we pick one? You pick one that you would really like to work on, and we're going to start figuring out ways that you can start working on the problem. The third session is the inactivity cycle. Most of us believe that as soon as we feel better, we'll get busy again. And it's opposite. We need to get going first, right? You gotta get up, you gotta get moving, and then teach people, this is your inactivity cycle, and this is your activity cycle. So how do you get going, keep moving? To the fourth strategy, which is, how do you get connected again? There's a lot of loneliness. There's a lot of people pulled away. We had a lot of isolation because of the pandemic. And so how then do we get reconnected with people? So it's all about social supports. What about reconnecting with family? What about reconnecting with church? Is there a need to really get connected with an organization? Whatever it is that the person would like to do to get reconnected, then that becomes the whole focus of intervention number 4. And then the 5th intervention is really just staying well. What is your plan for staying well? In between every single session is homework. There's, as you'll see in the workbook, there's calendars, there's handouts that are very specific. And so it's working with people to move all the way through with the homework, with the check-in. Did it go okay? Did it not go okay? Did you get stuck someplace? If you got stuck, let's figure out why you got stuck. The interventions are for 18 years and older. It's not a child intervention. There is a program soon that is being released by the World Health Organization that will address 10 to 15-year-olds, which is pretty close to this format. It's just a little more in-depth and actually also involves the parent or the caregiver. I think that's it about PM+.
I can tell you, when I had asked Rick to kind of explore what was going on globally, the recurring theme that he found in publications and even in like the Biden-Harris administrative report was that the training of non-specialists or lay people is the way out of the crisis. And, you know, even prior to Rick joining our staff, I always said, we've got to start doing things differently because we're not going to hire our way out of this. It's just not possible. There's not enough providers to meet the need. So, you know, having that reinforcement that looking at a different type of workforce really is what kind of pointed us in the PM+ direction. And the research that's been done on PM+ in other countries really does show that an intervention like this by a non-specialist can be just as effective, if not more effective, than having to go to a licensed therapist. And part of the other piece that I really liked about it was that it's really designed and targeted towards the population that you're serving. So it's really about training trusted community members to provide the intervention in their own community. So when we started moving forward, we identified a core group of 8 different organizations in Duluth and Superior to help us launch this. And those include the YMCA, St. Louis County Health and Human Services, the Office of Human Rights for the city, the BIPOC community, ACO, which is the Indigenous community, the trans and LGBTQ+ community, and those with physical disabilities, as well as PAVSA, which is the group that works with men and women who've been sexually assaulted. So really the idea is to adapt the workbook and the manual for those specific populations, and that's part of what our partners are doing with us. So things like the illustrations and everything are really targeted towards that group. You want to cover that one?
Sure.
Repeat the question, please.
Oh, sorry. She asked, what about people with mental illness?
It's certainly one of our greatest challenges as we talked about where do we start, right? We're onto this wonderful intervention that we believe is going to transform mental health care. So how do we really, and where do we really begin? Through all of the research that I was able to do, the groups that we identified were the most marginalized, and that doesn't mean that other people were not marginalized. So we talked about people of color, LGBTQ, public health, rehab, people who are coming out of strokes, out of difficult situations. So that was just our starting point. Our goal is exactly that. How do we continue? One of the people that we do have doing the training actually works with NAMI. And so there's a big connection there already. So what we tried to do as we chose these 8 stakeholders was try to get the biggest reach that we could. And although Chrissy is from Indigo over in Superior, she also is the chair. for NAMI. So absolutely, it's a great point. We know that this is it's a big reach and that we needed to start someplace. We've talked about once we get through our initial group of 8. So the training started last Thursday and we're training 14 people. 14 people will then be able to reach out to 5 people. So now you see the multiply community healing, right? So if we have 14 who are trained, PM Plus as we started is an individual intervention. So it'll be one-on-one work. That'll help people who are being trained feel good about the skills, being able to deliver the care. It can also be delivered in a group. So then thinking about exponentially what could happen, I could do a group 5 sessions with 8 people. Now start doing the math and you start thinking about the number of people who could be reached. We've talked about faith communities, because people in the congregation, people in the church, in the synagogue, we could train 1, we could train 2, and if 2 people could reach 8 people, and then it becomes a train the trainer program. So it's nothing that would be owned by the Miller-Dwan Foundation because it's a World Health Organization program, right? So how do we take that and keep moving forward and growing this whole other workforce? And there's a lot of professional language, and I don't necessarily like the language of evidence-based and upstream interventions, except this truly is upstream, because what we do want to do, we want to reach people in low to moderate stress before it turns into that crisis point.
Pick up a gun.
Touche. Before they think that it's time to end their own life, before they start feeling that whole helpless, hopeless, isolation, lonely, because of course, life is going to happen. And one of the early conversations that was really kind of fascinating, we were talking about, do we really want to call it problem management plus? Is there a different name for it? Would a different name be better? And thinking, we all have problems. How about if we just start with acknowledging everybody's got problems? That's okay. That's part of life, right? So let's not make it look flowery. Let's not pretend that we're going to go through life and this is just something bad. That's life. That's life. And all of these strategies are things that we all already know. It's just walking along with somebody who can help you, and somebody from your own community. If I went into ACO and I was the person saying, hey, I'm here, I can help. I'm a middle-aged white guy. And there's all sorts of assumptions about what that is. And so why not just train the people who are living in ACO? So Traci and I recently got back from New York City, and we were actually able to visit a place in Brooklyn where PM Plus has been implemented. It's affiliated with LSS.
Lutheran Social Services.
Thank you. See, I do that.
Acronyms.
Initial
Yeah.
acronyms. Stop it. Lutheran Social Services, and it's a residential program. So people are living right there. And it was fascinating first to talk. There are 2 case managers who were trained there. And they were talking about, yeah, we didn't know that this was going to work or not, but we thought, what the heck, we'll give it a shot. They said, oh, you guys, you got to see this because it really does work. It's fascinating. And then we walked out into a lobby area where there was a gentleman he figured out that we were there for talking about PM Plus. And he said, hey, I used to just yell at people. As soon as I'd see him, I'd just yell at him. You know what I do now? I breathe first. It was fascinating to see this man. And there's a testimonial. And that's the stuff that really touches our hearts and really drives home the importance of the work that we're doing. We also then went to Washington, D.C. We went to George Washington University and got to connect with our partners there. and then actually went to Senator Klobuchar's office to talk to her senior policy advisor. So we're talking about, as we're launching PM Plus and doing the initial training, how do we also create a certification? How do we create sort of an accountability to the model to make sure that people really truly are doing PM Plus, that we really truly are supporting the people who are doing the work? Because all of this work needs to be supervised by a licensed mental health professional. So as we launch, I will be supervising the initial group, and as we grow, I'm sure that we'll be looking for other licensed people to help support. So if there were people who were trained here, and we would meet once a week just to make sure that everything's going okay. I would then be able to guide, or if there were somebody ran into some difficulty, or there was somebody who was at risk, because we talk about, PM Plus does talk about, are you feeling safe? Has anything happened over the last week that's caused you major stress? So we put that out as honestly and as forthrightly as possible, because we know that that's also life. So let's put that right out front and center. And if indeed somebody is at risk, the licensed mental health professional can help navigate and walk through that.
Go ahead.
Are you saying that
Oh,
going?
yeah, for sure.
Yeah.
Sorry, I'll play.
Ella Phil Wellington.
Yes.
Are you saying that, it sounded like you were saying when a person goes through the 5-week session, that they are then qualified to turn around and help someone else, but that seemed kind of fast or easy or something. I'm wondering if that's what you're saying.
That is exactly what I'm saying. Because the interventions are really, they're really quite direct. The training itself is 40 hours. So when you do PM Plus training, it's 40 hours and you actually are taught the 5 strategies. So me as a trainer, as we're doing the training, I would say, now I'm going to walk you through when we're going to do role playing, and we're going to walk through, and role playing is a big part of the training. The second 5 sessions of the training, you would be doing PM Plus with an actor. So by the time you're done with training, you've done PM Plus twice. Then you would take what you learned and you would identify somebody. If you were trained here, you could somebody could come to you who's in low to moderate stress and say, I think maybe I want to try that PM Plus thing. You would then go through the 5 sessions. The manual, and I probably should have brought a manual. The sessions are all divided. So in your training, it is, you do this for 5 minutes, then you do this for 10 minutes, and then you do this for 20 minutes. So it's so ascribed. It's all right in front of you. So you know exactly what you need to do. There's fidelity checklists. So in other words, there's boxes that you check as you're going through to make sure that you've done what needs to be done in that session. It's really not, it's not really complicated work, and it's not beyond what we already do as human beings. It's just done in a way in which research and data are behind it. And so that's why we're partnering with the New School in GW, because they will also then help collect the data as we're launching this in the United States. The only way that PM Plus really came into the United States, other countries, so it was piloted in Turkey, Guyana, Colombia. Venezuelan refugees were a big target for PM Plus.
Pakistan.
Oh yeah, Pakistan. And so those countries, and especially some people in Amsterdam and the World Health Organization didn't think the United States doesn't need anything like this. The United States has everything they need. Well, fast forward to COVID, and in the middle of all the people dying in New York City, Dr. Adam Brown, who is from the New School, went to the mayor's office and said, all due respect, Mr. Mayor, we have a humanitarian crisis in New York City today, and we have an intervention. And so that's how PM Plus came into New York City as the first site. the mayor's office, and we met with the mayor's office in New York. The mayor's office declared there is indeed a crisis. There is indeed a way that we can expand the workforce. There is indeed a way that we can do this in an evidence-based sort of way. And so that's how it came into the United States. And then we were lucky enough to then partner and find the new school, who were very eager to come to the upper Midwest and partner with us to bring PM Plus to the Twin Ports.
And to Beth's point then, when people are trained, they're doing the therapeutic or the PM Plus for other community members, but they're not training those members then to give the training, right? They're
Correct.
Okay, great.
Yeah.
I just want to make sure.
Yeah, there will be a train the trainer program as well. Yeah.
Awesome.
Thank you. I came a little bit late, so I missed the first part with strategies, but I did hear breathe. You teach them to breathe. So I'm curious, does meditation come in as a strategy at all with the program?
Meditation.
Specifically, no. In what regard?
As a calming, teaching, breathe.
Oh,
and calming your mind and.
The whole idea about meditation and that bigger picture. I think because it's a brief strategy. I love your question, and I could just go all over the place right now. But what we're really wanting to do in a really short-term sort of way is that if we really can teach people the importance of something like breathing, I think that's the gateway to all sorts of other skills, and all of these skills really. How do you connect with people again? How do you start using your support system again? How do you identify a problem? How do you start feeling success is the start point, right? And probably will open up all sorts of gates for people in many different ways.
Yes, we started out upstream in youth, and now I'm feeling like it's peers. Am I missing something here? Is it more as much about peer work as youth? Because the upstream and the youth piece at the beginning, where are we?
It's definitely about, it is about upstream. It is about people within networks and within communities working with people in those communities. Peer support and the whole peer support initiative is really people with lived experience. So that's a bit of a difference, and the training is different for peer support versus mental health first aid versus PM Plus. One of our goals with PM Plus is this whole certification process, so that when you think about community health workers or other people who are working, this one really is trying to get into communities where people within your congregation, for instance, if there were people trained here, they already know the person that they're going to be working with. There was an old program many years ago in the Lutheran Church called Stephen Ministry. It's sort of like a Stephen Ministry, except that it's much easier, and it's done in an adherent way.
And it is 18 plus. PM Plus is for 18 plus. Rick had mentioned that the WHO is about to release something similar for, what is it, 10 to 15-year-olds. So we're kind of the first in line to pilot that once it becomes available.
You were saying, my hearing's horrible. I couldn't understand what you were saying, Stephen, or what were you saying, Stephen Ministry?
Yep, Stephen.
It's a Stephen.
Yep, STEPHEN.
Oh, okay, got it.
Katie?
Hi, Tracy.
Hi.
So I was just, I was wondering if you were completely finished, because one thing I'm not quite catching is, I hear how it's working out. It sounds really cool. I think it could be just huge in the homeless community. I think people without housing often have just broken relationships. Just creating those relationships with the board. So 2 questions here. I'm not really clear on how you're implementing it, other than, seeing a broader picture. You said you trained 14 people. Where are they going? Are those people paid? If you could go a little bit more on moving forward. And then my second question will just fly out of my head.
Well, if you think about it, let me know. I can answer the part about the payment. So, Miller-Dwan Foundation has always done grant making. And through the strategic plan, what the board had talked about was not necessarily doing a whole bunch of like little grants to organizations, but to really take all of our resources and focus it on something big. So these 8 organizations that we engaged with us to do this first pilot, we're giving them grant dollars, unrestricted grant dollars, to offset some of the cost of them training their staff in PM+. So like there's 2 people from the Y, 2 people from PATSA. And so our commitment to them is to provide them this unrestricted money for the first 2 years of this. And the ultimate goal was them identifying people within their organization that are already forward-facing and working with clients, so that they can just embed this right into the work that they do. Because we're not in a position to continue to, fund the organizations to do it. And I think that's the beauty of the program, is it's really designed to be an additional tool in the toolbox versus taking away something that they're already doing. So.
Well, and the dollars were really given to the organization, and the only caveat for them was that don't use the money to hire somebody to do the work. We really want this to become self-sustainable, right? So people within the organization, and to offset their time for 40 hours of training, certainly we want to do that. So that's where the grant dollars go.
I have a question. You've said the ages 10 to 15 as your, somewhere I heard that the ages 10 to 15.
Correct.
I'm thinking about the completely opposite end of life. I live at Keystone Bluffs, not because I need any of their services, but because my husband did. And there is a desperate need there for this kind of program. But I don't know that you would be looking to help the people at the 80 in their 80s and 90s.
Oh, I could just give you a hug. Absolutely. That is really, that will be. Traci, we're talking about 10 to 15 for a program that we would like to bring into the Twin Ports, that we would like to pilot. PM Plus, I totally agree with you. I think about PM Plus, long-term care, assisted living, absolutely, because that's the other population that we know was probably the most marginalized, and we haven't quite figured out the way that we're going to get in there, except it needs to be there. I mean, I think about all of the people who are in long-term care, and during the pandemic, many people were just stuck in their room.
Yes.
Right?
Yes, that happened at Keystone Bluffs just this
Yeah.
last
Yep.
month.
Yep. It's like, so yes. And PM Plus also can be delivered via Zoom. It doesn't have to be a face-to-face intervention, so it breaks down that whole barrier of transportation, or I don't feel well enough to get out, or in Minnesota, we're in the middle of a blizzard, it can still be delivered. So yes, absolutely, that resonates with me. And I would love, in college actually, I worked in long-term care. And I couldn't agree with you more. It's so needed.
Thank you.
Thank you.
You know, we're talking a lot about PM plus, and then there's that HopeX language that floats out there too. Just a reminder that HopeX is like the overall multi-phase initiative to solve the mental health crisis. PM plus is phase 1. And actually what you're talking about is kind of our phase 2, recognizing that the older adults in the community have really had some challenges over the last several years. So we're in the process of trying to determine not only how to get PM plus into some communities, but there's some additional licensed services that we're talking about creating for older adults, like intensive outpatient that can occur, you know, where older adults are. It doesn't necessarily need to be in a clinic or hospital. So that becomes phase 2, and then we have phase 3, which is all about family supports, because we know that family therapy, family skills and coaching are really limited in the community. So we're exploring how we can create a whole new caregiving force that's related to families, which could be an offshoot of our Amber facility. So
I think you should talk to the school board and have this program made a graduation requirement. Really, because if you want a radical change in this country.
For the school board.
If you want a radical change in this country, we gotta do a radical change. People just don't know how to cope.
Thank you for the comment.
That's broad brush, sorry. Some people just don't know how to cope. We're never taught.
One of the other partnerships that we're pursuing is what if we could get PM plus into undergraduate programs or into secondary, like community colleges. And so what if we really started teaching the skills and almost make it a micro-credential, so that when students are coming out with a 4-year degree, they really truly have a skill set that they can fall back on. So we are in conversation with higher education about that very thing. Yeah.
Could we come out of high school with that?
What's that?
Could we just come out of high school with that?
talk about the DBT training that you're just in
College.
Superior.
It would,
Everybody goes through higher learning.
yes. But so to that point a bit, we also, Amberwing's clinical model is doing DBT, dialectical behavior therapy. DBT has this whole skill set of just skills and not the therapy piece. So we actually are just now completing a project in Superior, in the Superior School District. We are training elementary, middle school, high school counselors in DBT skills so that they can now teach those skills within the Superior school system from elementary all the way through high school. And we're now in the implementation phase of that work. I believe that when we bring this adolescent program that's piloted by the World Health Organization, once we bring that, I think that's another intervention that we could bring directly into schools. And it doesn't need to be a therapist, right? Because that's the whole other piece. There are not enough therapists. There are not enough mental health professionals to do the work. So if we can train this other workforce.
That's a great segue to my question, my second question.
Oh, good.
So
I was working so hard to get you to that second question.
So I'm kind of seeing, visual diagramming this out. You get these people out there and you're spreading this good work, and how to do these things, how to breathe, and all these strategies. I'm kind of going back to what Destry was asking too. So you're talking about, kind of the general population of us that are, dealing with this stuff. And I'm forgetting your words about, like, let's call it first and second degree stress or whatever.
Low to moderate.
Low to moderate, thank you. So one of your peeps is working, somebody from PAVSA is working from somebody that's low to moderate, or their group or low, whatever, and somebody is high. Then we know that there aren't the funds for people. There isn't the availability
let alone there aren't the funds. I mean, if you have enough money, you could probably find a therapist. But people who are using those resources already probably don't have that kind of cash. So what is that? What is there a flow chart that happens to somebody who either shifts from low to moderate, or you identify as higher needs, maybe some medication needs or higher therapy? Thank you.
Yeah, it's a beautiful question, and two things. If somebody does go into crisis during the course of PM Plus, with our small start, we've been able to build enough networks and safety nets. In a bigger picture, I think we're going to have to really think about how, and because it's pretty controlled with these initial 8 groups. As we grow it out bigger, I think there are implications, and I think, you know, if it's connecting with the urgent care, if it's connecting with whatever the case might be. So yes, the other thing that we're hoping is that if we really do start catching and addressing low to moderate, that we really could potentially decrease some of the demand for specialized care, because I think that's the other piece. We've also talked with some partners in Wisconsin about what if we could get into family practice and help family practice understand that there's this intervention that is not, it's not going to cost people anything. And the network that we've created with our 8 stakeholders, they've all said, when we got them all in the same room together, basically for the first time, they said, we need to have a PM Plus network. So then it becomes, and we've thought about even a PM Plus sign that could be out and in front of somebody's door, so that we really can create the network of normalizing people having problems, and there's a way to deal with it before it gets out of control.
Good morning. Thanks for all of this great information. I'm hearing a lot about social service organizations, children, elderly. But what's coming to mind for me as leaders in our, in our community, they're going through a lot of stress. It's a stressful time, a lot of challenging issues. Has there been any thought given to sharing this type of information with leaders in our community, and then downwards to supervisors who are leading departments and managing people that have very complex issues right now? And we're often told we're not mental health therapists, etc. However, we might be the only point of contact for individuals that have these complex issues. They need support, they need someone, and you might be the only point of contact. And so I'm curious as to how this might be implemented in the workforce outside of just social services. This is important for all of us in the community.
That's a great question and comment, and you're reading our mind, actually. We have been, as we're strategizing where to go after this first cohort of people, we've talked about what are the commercial applications of this, because we know, being that we're based in a hospital system, EAP programs oftentimes are not successful. So being able to provide some other intervention is really attractive. We actually met with Matt from the Chamber of Commerce to talk about his perspective from the Chamber, how businesses large and small in the community would react to something like this. And his response was really positive, and he said exactly what you were saying, was they're hungry for this because they have limited options. So as we talk about, we refer to our stakeholders as community-based organizations or CBOs. So we envision as we move this forward, there'll still be a CBO focus, but then there would be this higher education and school focus. And then there's also the commercial or corporate focus that we could create, so.
Here is a question from the online attendees, and that is, can you tell us a little bit more about who else outside of New York and Duluth is doing this in the US? Are we really that unique?
Yes.
Yes, we're really that unique. We are the second site to work with a university to bring PM Plus with the data, with the research, with the fidelity. We are the second. There are a couple of places in the United States who are trying to launch PM Plus, but they're not working with higher education. And to us, if we talk about really, and I say gold standard, which is almost too cliche-ish because it minimizes, we have to do this correctly. If we are bringing in a new workforce, and if we really want to do this in a responsible, heartfelt way, both of those, responsible, intellectual, heartfelt, we need to be working with higher education. We need to be working with the people who know the work from its beginning, and they will collect the data and they will help with the research so that we can just continue to roll out in a responsible way.
All right, I'm mindful of time, and so this will be the last question here. I'm looking at the audience questions in the chat. Just, and I know if other people have follow-up questions, obviously we're ending early enough for the transition period to follow up too with Rick and Traci here. But what can we do, having heard about this amazing initiative today, between now and the next phase, or how can community members plug in and get active, be boosters, be supportive, and make sure that this is a success for Duluth?
Well, there's a couple of things. Like I said, we're probably gonna roll out the second cohort in June. So we're already starting to create a list of interested organizations or people. So reach out to us, and I brought cards if people want my cards. If you're interested in moving forward with potentially being a CBO or a group that implements this within their own organization. You know, I have to do the thing because I'm a fundraiser. Obviously, all of this costs the foundation money. So if anyone feels charitable, we do accept gifts to keep moving this along in the community. And I think also just being really vocal advocates as well, because you'll hear people talking about this or asking questions. So, you know, go ahead and share the information that Rick and I share. You know, you can certainly point them in our direction as well. It really is going to be a community effort, and all of us together multiplying and making it happen. So, anything to add?
And on that, oh, go for it.
I just want to support Traci. You know, you can have a money ministry. There's nothing to be ashamed of if you have a money ministry. Just saying.
Yes, it's how we've been able to do all of the work we've done over the years. Soul Bay Hospice House, Amberwing, all of those things. So it's really been
So I know
community
Koresh
effort.
has a follow-up question for one-on-one, but for today, since we are transitioning, let's give everyone let's give a huge round of applause for Traci and Rick. Thank you for your leadership. You're doing a lot of